Hello, hello.
Hi. So
it is exactly 1 week until I have open heart surgery, a full sternoctomy I think it's called, where they will remove a tumour from inside my heart.
correct. Yeah. So if you've been watching this channel for the last year, you'll know that this is something that we've been dealing with. Sorry, there's a plane right overhead. We're currently on a nice dog walk with Bonnie out in the forest. Yeah, this is actually where I used to work. If you're an OG, I used to work at Go 8, but we thought we'd come out here, get some fresh air. We've been talking about everything that's coming up over the next week, and like I said, if you've been around the last year, you'll know that Benji went into hospital in February 2022.
Last year, yeah.
And we were preparing for him to have open heart surgery then, but the doctors changed their mind and they wanted a bit more time to look at it.
Monitor me,
yeah,
see what was going on. I think they're hoping it would resolve itself, which it has not.
Yeah, they wanted to do lots more checks. So you've had a ton of MRI scans, CT scans, hospital appointments, visits, blood tests, basically, everything.
I've had an MRI scan every other month, and then a visit with my specialist every other month in between that, if you kind of get what I mean. The
reason that they wanted to take the time is because the tumour is in a slightly awkward place.
It's in my left ventricle, which if you look at a diagram of the heart, it is literally in the pointy bit, sat in a pocket. My tumour is a lipoma, is just smaller than a golf ball. It's quite a big chunk to be taken up. Hence why I've been feeling fatigued, and increasingly really, haven't I? Over the last probably couple of years, and we couldn't really explain why.
Once you got the diagnosis, it all made more sense. The thing that was so shocking is that we just never expected this to happen. Obviously Benji's only 28, he's fit,
I've never had any heart issues.
No, obviously it was a massive shock, and the last year we've been processing it and what it means. And I
had quite a dark few months, didn't I, at the start?
I think
of trying to process what my life would become with it in there. I kind of felt like a little bit abandoned, didn't I? Through no fault of obviously the doctors and that, but I felt like I'd been prepared, and for 11 days solid it was, you're having open heart surgery, you're having open heart surgery, and then it was like, we're just going to see what happens. We kind of got a bit of a new outlook, didn't we, after a few months, and then started to we slotted into our new way of life kind of thing, wasn't it?
The doctor gave you the all clear to go and live your life normally, so they actively wanted him to live normally. We travelled
to test,
just to see if it would change in shape or size, and long story short, nothing changed. It didn't move, it didn't grow, it didn't, nothing. So at the beginning of January we met the surgeon. We think they're going to be writing a paper on this tumour.
He is incredibly interested, because there's no reason for it to be in there.
Yeah.
It would make sense if it was cancerous, because it would be taking a blood supply, but it's not.
It's benign.
It's benign.
So at the beginning of January we met the specialist, and he told us that he was ready to basically put Benji forward for surgery. So
they kind of exhausted the other options of just leaving it, because obviously I'm 28, so I'm in the best time of my life to have a surgery like that, because my body's fit, I'm young.
You should recover well. But what's even crazier is happening on my birthday, of all days.
Could be any day of the year.
But the thing is, a lot of people have told us they think it's a good omen, so hopefully at this point you're seeing this video, everything's gone smoothly and Benji's in recovery.
And because you won't be seeing this video if things haven't gone smoothly.
Let's not even touch all the wood in this forest.
If he dies, he dies.
Benj! So 1 week to go. Let's do this. Heart surgery. Yes.
So they've already got me from last week when I had my pre-operation appointment.
Yeah.
I feel like I'm about to do one of you remember neck nominate or or ice bucket challenge. Oh, and that's not a big deal, because a lot of people shave their chest, but it feels like my identity.
I know. It will grow back though. You're just gonna have a big old scar there.
If anyone needs a little short curly ginger toupee or anything like that, let me know, because I have probably enough to do 2 to 3 people. Also, did I tell you what I was thinking last night?
What?
It might be the saddest thing ever. Is when I was in hospital last year, I re-downloaded Candy Crush. I don't know if anyone ever still plays Candy Crush, and last month or so I've been playing it again, and you build up a little streak, and then every day you get a bonus and a reward. I was thinking last night, if I'm unconscious, I might lose my Candy Crush streak. And I thought, on list of priorities and worries, no, I'm not going to lie, it's up there. It is up there.
I will do it for you.
No, it's fine. It's fine.
Okay, you're in your first room for the first night.
Yeah, so I'm going to go again to ICU tomorrow, having the operation. I expect to spend the night in ICU, and then I'll be coming back to a different room, so I can't unpack or anything, but it's really nice in there, isn't it?
Really nice. So we'll show his
I
full
think we
room.
mentioned before, but I'm at the Spire in Southampton. We've just seen Mr. Sang, the surgeon who is going to be doing my surgery tomorrow. It's actually earlier than we thought.
8 AM.
8 AM-ish. They're going to come and wake me up about 6-ish and give me some like pre-op sedatives, I think, just to make me a bit more relaxed and help the process. And then obviously when I get into the theatre, they'll pump me full of the good stuff and I'll go night-nights. Apart from that, there's not really anything that's changed,
No, he said it will. You'll be done between 12 and 1, and then if everything's good and you're stable, they'll wake you up between 2 and 4.
And I'll be drowsy for a few hours afterwards.
And then I can come and visit you. Good morning. It is about 6:30. I have FaceTimed Benji. He is in his gown. He's ready. He's had the medication. I'm really trying to hold it together because there's no point in getting emotional. I knew that this day was happening. I knew I'd feel like this. It's just a waiting game for me, like until lunchtime. So I am in my gym gear. It's my 29th birthday and this is how I'm starting the day. I'm gonna go for a workout, go for a run, because I thought that those sort of good endorphins might set me up for the day. I'm gonna read my book, I'm gonna open my birthday presents, I'm gonna have a nice hot shower, do my hair, do my makeup, and just kill time until I get that phone call. And even then when I get the call, I can't see him immediately because he'll still be asleep for a few hours. They said anywhere between 2 to 7 hours, so it really is a case of just sort of waiting. I feel good for him, I'm happy for him, this is what he wants, it's the right thing. But when the doctor obviously sat there yesterday and said there's 1 in 100 chance, like, you know, a surgery comes with so many risks, and we had to sign away the paperwork, and it was just so much to process, and I have to just keep believing and have faith that this is the right thing and that it's going to be fine. I think because there's so many risks and unknown factors, and that taking it out might leave some scarring for him, and I don't know what that will lead for in the future, but I just can't think like that. I just got the call to say that he's out. It's 2:30. He's out. They removed the tumour successfully. He's stable. He's doing well. Oh my god. Such relief. I've been holding it together all day. Oh my god. They seemed really pleased with the outcome. They said that he's going to be pretty drowsy and that he should be awake within the next few hours. They only have visiting hours 2 till 5 in the ITU. It's 2 till 7 in the actual hospital bit, but we don't know if he'll be awake before 5 because it's already 20 to 3. I did say to them that I'd love to speak to him when he wakes up, so we're hoping that I can sort of have a chat with him. I'm just going to wait and see, but it's just such a relief to know that he's okay. And the waiting was just like really eating me up towards the end. I had so many intrusive thoughts within the last sort of hour. I'm so happy for him as well. He's gonna be so pleased to hear they removed it. Why didn't I pack tissues? I'm such an idiot. I'm just so relieved. Oh, I'm so relieved. Good morning. It is Saturday the 25th of March and I'm currently outside the hospital waiting to visit Benji. Yesterday I got an update that he started breathing on his own at 6:30, and then at 7:30 he FaceTimed me. It was a really difficult call, but I was so relieved to see him. He had an oxygen mask on and all the wires, and his voice sounded quite crackly, but he was already trying to make jokes, and he referenced the restaurant, and he said I'll be at the restaurant in 5 minutes because I had a meal with my family for my birthday. And he said please have a porn star martini on me. He also said please save me a dessert. So there was quite a lot of weird stuff coming out of his mouth, but he also asked where I was, and he said he felt like he'd been beaten up and that he was in a lot of pain. So we did have some conversation, but obviously he was heavily dosed up with medication, so I don't think he'll remember any of the conversation. He's awake and functioning much quicker than I expected, which is so impressive. And I have been thinking about it a lot, about how much admiration and appreciation I have, and I'm sure I speak on behalf of Benji as well, for the medical professionals that obviously helped him yesterday. These incredible surgeon that took out the tumour, the doctors, nurses, staff, everyone, the admin team, everybody that makes something like that happen and run so smoothly. I am so impressed and also so grateful. And without these incredible people that work so hard and are, you know, study and are so well educated, and they do this kind of thing day in, day out, and dedicate their life to helping people like Benj, and I just have the most respect. So a huge thank you to all of the staff that made Benji's time here so comfortable and have been so amazing. I just cannot even fathom what it must be like to work somewhere like this.
You can just clamp it down for now. Let's put a bump. Because we're not used to.
You're currently in the ITU, critical care.
Sloth.
You feel like a sloth.
Everything's hard.
Everything's hard. But you've got a little bit of soup to dip into, some lemonade, Pepsi. You're doing good. You're going to be moving in an hour. Less than 24 hours since you've come out.
To the Hilton.
Not to the Hilton.
Bugger.
This is the last time that you're in the ITU. Time to move.
In and out within 24 hours.
In and out in 24 hours. So impressive. You're just a bit tired.
Really, everything's quite hard to do.
Everything's hard to do. I understand. We're in his room now. Your parents are coming in an hour, so I'm going to leave you.
I'm
So you
really
can rest.
struggling with my breath.
You are, but we're going to get some more medication in you now.
I can only like take in a quarter breath. Feels like my chest is too small for my lungs, but that's what the tramadol helps with.
Yeah. You're doing amazing though.
Oh.
You just need to rest.
And
I'll come back tomorrow and we'll give another update tomorrow, okay?
Okay.
It's Sunday the 26th of March. I'm on my way up to the hospital. It takes me an hour from our house. I have to go to my mum's house first and drop Bonnie off or pick her up, and then go to the hospital. It's about 40 minutes from my mum's, so that's okay. And Benji's had a bit of a wobbly morning. He woke up and was in a lot of pain, and he coughed, and which is good because you want to get the phlegm up. But I think he just really was really struggling this morning. I think it's fair of me to say that he wasn't in the best of moods. I think he was feeling frustrated, but there was not an awful lot that could be done apart from sort of just giving him more painkillers. So I think they've done that. And then he FaceTimed me a few hours later, and he was in some sort of like chest brace, like it's a blue brace. I'll try and show you if he wants to come on camera.
Awful day yesterday after you left. My parents came and I could hardly even talk. They couldn't get the painkillers right, like the mix. I think one lot didn't work, so I had like 4 to 5 hours where I basically didn't have anything, and it was just awful. And then this morning, woke up and I was coughing, and it was just honestly like my chest was going to explode. But they did a suppository, like an anti-inflammatory, and I think that's calmed everything down inside my chest. So it's a lot better.
You also had a wash. They cleaned you. You brushed your teeth.
Oh, I cleaned myself.
Oh, and your dress.
I just did a walk. Maybe I had to put that clip in or something.
Yeah,
It'll be portrait, but
you did your first walk.
So that's a day before, a day earlier than planned.
Yeah, absolutely. Little chest thing on you.
Oh yeah,
this
so
is new.
I've got this chest mount now as well, which helps tuck me in and makes me feel all secure. But
I don't know if psychologically it's helping as well, just knowing it's protected.
My things in there still.
Yeah.
Still got my pads on. I've still got one chest drain, which is pretty rank. I won't show you that.
And you don't have a catheter anymore.
I don't have a catheter anymore. Yeah.
Well done.
Nice to know.
Okay, let's stop there then. Well done. Hey, so they've swapped his oxygen for a...
I'm going to take it off while I'm talking, so you'll never be able to hear me anyway because I mumble.
Yeah, they swapped it for a mask
Yeah, the
today.
tubes where they were going up my nose, and the air was so dry, it like crusted out all my nose, and it like cut it up quite badly inside. So I was having, not nosebleeds, but I was like filling up tissues with blood earlier. I've had a good day today, haven't I?
Really good. You've just got changed
I've
into
done
fresh PJs.
three laps, so 1 lap 3 times.
Yeah. Yeah, with the
Morning,
physio and now with
lunch
me.
and afternoon. Mum came up
Yeah.
for about half an hour, about 45 minutes, didn't she?
Yeah.
I actually get so exhausted from like
Talking.
interacting with people.
And we've just updated Instagram, so everyone knows now, which is...
Yeah, I find it really hard to find the line of keeping people updated, but also not rushing it and not saying things before
you're
before we
ready.
100% know and things like that. Basically, like we did it to the.
You did it.
Yeah.
You
no,
did
we
it.
did it. There's no way I could have done it on my own.
So
Teamwork.
proud of you.
Teamwork makes the dream work. I've been low on my oxygen levels,
And your
hence
potassium.
the mask, and low on my potassium, so I've been having some extra things.
But you look better, and you've got your fresh PJs on.
I feel a lot more confident, even when I'm walking.
And they've taken the dressing off, so we've seen the wound and
Right, yeah,
the scar.
Meaty, isn't
It's big. I think we'll leave it there for today, and I'll see if you're up for it chatting again tomorrow.
it? Yeah, we're gonna have a little nap.
You have a nap. I'm going
We
to
were
close
just
the
saying
blinds.
that Brogan's gonna pop back home now, and we'll probably watch
Bake Off.
Stand Up to Cancer Bake Off tonight.
Yeah. Yeah.
We haven't seen any of that, have we?
No.
We've just got back from my 4th lap of the block today, which is most I've done in one day before, so that's good. And I've got a nebulizer. My second nebulizer helps break down all like the phlegm and all the fluids I've got in my lungs of like my lungs trying to protect themselves. Yeah, my oxygen levels have been really low today. Started off this morning around 74%, really struggling to get them above like mid-80s, but because I've got like a partially collapsed left lung where it just hasn't kind of got back to full strength. They've done loads of blood tests, like artery blood tests, just to check that I don't have like a chest infection or anything like that. Making good progress, aren't we?
You've got fresh PJs on again.
Fresh PJ, we're
Had a clean.
We're rotating my PJs at the moment.
And you got fresh compression socks on.
Fresh compression socks, which are a lot harder to put on than we thought.
Yeah, I tried to help. Well, I did do it.
I can't do it because I can't pull them up, so Brogan was...
I cleaned your feet and dried them for
I felt
you.
like Julius Caesar or Emperor Nero or someone like that with his court of ladies that helped do his things. It wasn't the most sexy that I've ever been in URS today. My appetite's been awful, hasn't it? I've had like half a croissant most days or like a little bit of pasta, but today I had like a full meal, so
Yeah.
that's a really big positive. Hello.
It is
Wednesday today.
the 29th of March. You're 5 days post-op,
Yeah.
and you're looking good today.
Yeah, I feel a bit drained. I didn't sleep very well last night, so I just had a little like 10-minute snooze then, didn't I? We watched Supermarket Sweep. But this morning went well. I did 2 full laps like consecutively of the top floor, and then
You've been eating.
I had my first poo today. It was very exciting. Told everyone about it. All the nurses are very excited because obviously it means my body's repairing. And I'm starting to flush out all the opioids and that, because I'm not on any opioids anymore. Like your morphines and your oxycodones and stuff like that. Yeah.
That's it really, isn't it?
Yeah. Yeah, I think I'm going to have an echocardiogram later today. Or maybe tomorrow. Yeah, we're definitely getting there, aren't we?
Yeah, well, you're
So
getting
having a
there.
bit of a tired afternoon. I always feel a bit tired after you visit, because I don't really do much talking, and after talking.
But you
for a
were
while,
pretty,
I'm exhausted.
you were pretty down when I got here, but now your spirits are up a bit, so
Yeah.
that's good.
Yeah, it's been a nice morale boost.
Good.
Yeah, other than that, there's not really any updates, is there really? Just keep
No.
on plodding. Keep on plodding on.
Well done.
Time to say goodbye to the room.
Time to say goodbye. It's Friday the 31st of March. It's all done.
Yeah, crazy. Feels really weird. Like, I'm happy, but I feel a bit sad. Like, you know what I mean?
Yeah, it's been a lot.
It's
You've gone through a lot.
It's been a roller coaster. Yeah, I've got a crusty nositis. I get it when I'm like stressed, or if I get like dirt or mud in like a cut. So I've obviously got some sort of bacteria that's gone into my cut, and so it's just popped up at the weakest point. So I've got cream on it, but I feel good. Still in quite a bit of pain, but I've got medicine to go home with, haven't we? And we've got.
Yeah, you got
I
your
didn't
brace on.
realise I've got to wear my DVT socks for another 5 weeks.
He hates
I didn't know that.
compression socks.
Oh dear. We'll do a bit more of a roundup when we get home, but we're trying to say goodbye to the room.
Bye room. Thank you for caring for Benj.
It's been one of the weirder room tours we've ever done.
Yeah. And thank you to all the amazing doctors and nurses.
I've had some really nice
here.
nurses that just come in and like keep you active and keep your brain moving as well. Like,
and some lovely conversations we've had, like.
Yeah.
So let's go home.
Let's do it. Right, I am 10 days post-op now. I've been home for about 3 days. It's been a bit of a struggle to kind of fall back into home life. We have been working out how much I need to lean on Brogan, how much Brogan can help me with certain things, and how much I can be left on my own devices like a big boy. My dad's kindly brought over our old treadmill, so today I did my first walk on there, about 10 minutes of just really slow, ploddy walking, so I still don't feel steady enough to go and walk out on the pavement and the concrete. It all undulates, and I feel if I stumble, then I will stack it. Yeah, and we've got the granny chair in the front room, that red chair that you would have seen on Instagram. It's perfect for me because I really struggle with my posture and keeping this kind of straight so that my sternum's kind of in a comfortable position, so I can kind of recline the chair back, move my legs back, and then it also tips me out when I need it as well. So that's quite good. Yeah, sleeping's kind of been a bit of a nightmare. I've currently completely taken over our bed. I've got about 6 pillows behind me to put me on a bit of an incline. I reckon probably another week of that, and then we can kind of share the bed again and be a bit more comfortable together. Where else are we at? I feel like the thing that I've learnt most about the surgery and how I'd feel from before the surgery to after the surgery is it's not the pain. I get the pain. I've been in pain before. Broken my leg. I can deal with the pain. It's just the constant discomfort. I can't explain it. It doesn't go away with any of the meds. And it's just, you just never feel like you're in the right position, and you're just constantly, it's just not nice. So again, hopefully, they said that it would take about 6 weeks for my sternum to fully heal. And then obviously then I'll be a bit building on cardiovascular health and physical, like muscular health from then on. So I don't know how long that will take after that. But I say hopefully another 6 weeks until I can just be in like a better place and within myself really. Still got a really positive outlook on it. I had loads of support from obviously Brogan, both of our parents, friends and that, and family, and again with you guys. Really appreciate all the messages we've had on Instagram, and again most of all I just can't explain how incredible the staff were at the hospital. Couldn't do enough for me, always there with amazing information. So calming as well, like when someone really knows their stuff and explains to you this is why you're feeling how you are, it just really puts your mind at rest. So yeah, I just can't thank the staff at the hospital enough. They were incredible. Literally couldn't have done it without them, because I would have probably struggled cutting through my skin. I expect this video is horrendously waffly because you can't plan for something like this. It was like a step-by-step where we got to each kind of point. So yeah, sorry it's a bit of a waffly one, and hence why I'm kind of doing it on my own, and just Brogan can't kind of tell you how I feel, so that's why I just decided to do it like this. But yeah, if you've watched this far, thank you. If you've come and supported us on our Instagrams and that, thank you. And thank you for giving us some space as well, because that's been really key. Yeah, so thank you. Please subscribe. I don't know what Brogan normally says, like. And I'll see you all hopefully on a bit more of a cheery video. Love ya.